Okay, hi everyone. Today we'll talk about the TMJ, which is the temporomandibular joint. Before we start, we need to be very confident about the anatomy of bones, two bones, the mandible and the temporal bone. Temporal bone, not so much. You just need to know the mandibular fossa fovea. But for the mandible, you need to know everything because the mandible has the origins for all the masticatory muscles. And also, there are a lot of structures passing through different parts of the mandible. And the two main things which are involved in the TMJ in for mandible is the condylar process, and for the temporal bone is the mandibular fossa. That is, the condylar process fits into the mandibular fossa. So the TMJ has two main components. It has a passive component and an active component. The active component, by name you can guess, it's the part which is responsible for moving the TMJ. So those are the masticatory muscles. There are four main masticatory muscles. I assume all of you know the four main masticatory muscles because you'd have learned about them during in the facial muscles. They're the medial pterygoid, lateral pterygoid, and temporalis and masseter. A lot of people confuse the fact that buccinator is not a masticating muscle; it is a muscle of facial expression. So buccinator is not a masticating muscle. The passive components are the bones, which is the temporal bone and the mandible, and the ligaments and the capsule. Also, there's the TMJ special in the fact that it has an articular disc. Not all synovial joints of a body have an articular disc. We'll talk about the articular disc later, and also the TMJ is not a typical synovial joint because it has something different which not all synovial joints have, which is first the articular disc, and also the articular parts of the bones are not lined with hyaline cartilage. Instead, they have fibrous cartilage. So which also makes sense because when you get old, a lot of people experience joint pains like in their elbow and their knee, but you don't have a lot of joint pain in your TMJ, which is because the hyaline cartilage doesn't wear out. The fibrous cartilage doesn't wear out. Now, the TMJ is a gangliomethodal joint, which means that it has both hinging movement and gliding movement. You don't have to remember gangliomethodal joint, just remember hinging movement and gliding movement. Just in case the professor asks you, know that it's a gangliomethodal joint. Um, like I said, it is formed by fitting of the mandibular condyle into the mandibular fossa, and there's an articular disc. This is the picture of the joint. This is the mandibular fossa and the condylar process of the mandible. Okay, so now the articular disc of the TMJ divides the joint into two parts. It divides into a superior cavity and an inferior cavity. The superior cavity is responsible for gliding movements, and the inferior is responsible for hinging movements. The way I remember it is as that since it's inferior and hinging is usually moving the jaw downwards, so the inferior component is responsible for hinging movement and the superior component for the gliding movement. See, this you can see the articular disc, superior cavity and inferior cavity. These are the two parts of the bones which make the TMJ. We have the mandibular condyle and the mandibular fossa. This is the base of the skull. You don't need to know specifically for TMJ but you need to know it because it's a final exam question. This is the skull base. You need to know all the structures, and what passes through all of these structures. It's You have to remember this for two final exam questions, so it's an important thing. Then let's talk about the capsule and the ligaments. The articular capsule, like another synovial joint, the TMJ also has an articular capsule. The articular capsule surrounds the entire joint. That is the part where the two bones meet. Um, The capsule encloses the synovial fluid, the articular disc, and two ligaments, which we'll talk about later. But the main function of the capsule is to hold the joint in place. That is, it prevents any sidewards or excessive downward movement of the joint. So it's basically securing the joint, the articular capsule, and enclosing the synovial fluid. Um, we can see two of the ligaments in this picture. We can see the articular capsule very easily. Then we have the sphenomandibular ligament and the stylomandibular ligament. We'll talk about them later, but just to have a picture, this is a medial view. That is, you're looking at the jaw, looking at the TMJ from your tongue area. That is, it's a medial view of the TMJ. The ligaments are present inside; they're not outside the TMJ, outside the mouth area. So they're more medial and not lateral. Laterally, we have the muscles. Medially, we have the ligaments. Okay. Now, this collateral ligaments or discal ligaments, these are ligaments which are present inside the joint capsule. That is, they run from the articular disc to the condyle, to the mandibular condyle. We have two. We have medial and lateral discal ligaments. The, as the name suggests, one is present medially and one is present laterally. One runs on the middle part from the articular disc to the condyle, and then one is lateral from the articular disc to the condyle. Uh, the function you don't need to know as much, but just to just to just to know it, it allows passive movement of the condyle without gliding. It's responsible for passive movement of the condyle. Like when the joint moves, it it allows passive movement. Uh, Next, we've talked about the movement. Then we have the temporomandibular ligament. The temporomandibular ligament, because it's a temporomandibular joint, it's very easy to remember temporomandibular ligament. It has two parts. It has the outer oblique part and the inner horizontal part. So one outer, in the sense it is more lateral, and the inner is more medial and it's present inside. The outer part of the outer part, which is the oblique part, runs posterior inferiorly. That is, it runs downwards and behind towards your ear. You don't have to know specific landmarks, but to impress the professor, you can say that it runs from the articular tubercle to the zygomatic process. But to say that it runs posterior inferiorly on the TMJ is enough. Then we have the inner horizontal part. It is horizontal from the name. It is present inside and it is horizontal. Also, you don't need to know exactly the landmarks where it runs from, but to know to if you need to get an A, obviously everyone's aiming for an A, but to be precise, you can tell the professor, or if he asks you, it runs from the outer surface of the articular tubercle and to the zygomatic process. These two. These pictures are very good. You can look. This is the outer oblique part of the temporomandibular ligament. We'll talk about the other two ligaments later. Then we can also see the joint capsule in this picture. You can see the articular disc is dividing the joint cavity into two parts, the superior and the inferior part. These are structures that you need to know. Maxillary artery is a big artery. It has quite a few branches, but not a part of TMJ, so we'll not talk about that here. Then you have two accessory ligaments. They're accessory, that is, in the way that they support the joint. They're not main ligaments. We have the sphenomandibular ligament. You can tell by the name, if you know the anatomy of the mandible, you can tell already where it runs from. It runs from the spine of the sphenoid bone and moves downwards to the lingula of the mandible. Lingula is just, I'll show you a picture of the lingula. Lingula is like an outward growth, I wouldn't say tuberosity. You can see in the picture, this is the lingula. So the lingula covers the area where the inferior alveolar nerve moves through, which is the mandible foramen. So you can think of a lingula as a covering of the mandibular foramen, and mandibular foramen there is nerve and artery that you learn in the path on with them specifically. Uh, then we have the stylomandibular ligament, again styloid process of the temporal bone and runs forward and downwards. So it moves antero-inferiorly, forward and downwards um, to the rams of the mandible. Picture you can stylomandibular, styloid process, mandible, ramus of mandible, and sphenomandibular, spinal sphenoid bone to the mandible. The articular disc, the synovial, the TMJ is special in the way that it has an articular disc. The articular disc is thick fibrous connective tissue, which we've already talked, that divides the joint into two cavities, two parts, and it is avascular. That is, it doesn't have any sensation or it does not have any blood supply. Avascular usually means blood supply, but it also doesn't have any nerve fibers. That is, it is not innervated. You can see, you can read on the slide that it is thicker in the anterior border. It's important to know because when you have a lot of you must have heard that a lot of people have TMJ. You just say in layman's language, you say I have TMJ. What is TMJ? It's when the articular disc is dislocated. The articular disc is dislocated because it usually moves a lot anteriorly. Like it moves downwards and anteriorly and doesn't go back into its place. I have an animation which shows how the disc moves. When the disc does not move in that way and gets stuck in one place, that's when you get a lockjaw or TMJ pain. Central area is the thinnest. Okay. I'll show you the I think is somewhere. I think it's not in this presentation. Okay. Anyways, I have a picture which, because I had a very good GIF which explained it. So you can see it moves downward and anteriorly. When you open your mouth, the disc moves anteriorly and downwards. And when it gets stuck in that position, that's when you usually have a lockjaw or and TMJ pain. TMJ pain is usually due to dislocation of the disc. Also, there's retrodiscal tissue that is retrodiscal. By the name, retro outside the disc, discal. It is behind the disc. Behind the disc, it is loose connective tissue. And it is responsible for providing support to the disc. You can see the green part is the retrodiscal tissue. It is loose connective tissue. It is non-elastic. That is, it is not very compressible. The also the anterior part of the posterior part has the retrodiscal tissue, and the anterior part of the articular disc is attached to the capsular ligaments. Capsular ligament, there's two parts, the superior and inferior. The disc is also attached by tendinous fibers to superior lateral pterygoid muscle. You must have learned about this during in the insertion of lateral pterygoid muscle. So the superior part of the lateral pterygoid muscle inserts into the joint cavity. Into the joint cavity of the TMJ. It is the only muscle of mastication which inserts inside the joint cavity, the superior part of the lateral pterygoid. The inferior part does not insert into the cavity, it is outside. It inserts into the articular capsule. Okay, we've talked about all this. So, like any other synovial joint, the TMJ also has synovial fluid. Now, muscles of mastication. I don't think it's very difficult. You just need to look at the pictures. Sometimes the origin insertions can be a bit tricky if you're not very confident about with your anatomy of the mandible. So I'd suggest learning sphenoid and mandible both, because the sphenoid bone also has origins for the muscles. So you might have learned all of these in the muscles of facial muscles. I think that's a question. You might have learned all of this in that, but there's no point me repeating them. You just need to remember the pictures. If you remember the pictures and you know the anatomy, you can make out origin insertions, and they don't have to be completely spot on or perfect. You need to be around the area, but for something like the superior part of the lateral pterygoid, you need to know that it inserts into the capsule because that's an important thing. Innervation, we've talked about the mandibular nerve. We might talk about the innervation of all these muscles. Okay, we've covered the TMJ. This was a quick, short summary of the entire TMJ. You need to know masticatory muscles and what I've talked about till now, and I think you'll be more than fine in your exam. Okay, thank you very much.